What's up, Scrubs Tutors family? If you're new here, this is the channel where nursing students, especially from Walden, Chamberlain, and similar programs, come to master iHuman cases and start scoring higher fast. And to everyone who's been supporting, seriously, I appreciate you. Now, in this video, we're diving into the physical exam section of iHuman cases. And here's the key thing you need to understand. The physical exam is not about clicking everything. It needs to be targeted, efficient, and evidence-based. Start your exam broad, but very quickly narrow your focus based on the chief complaint and the history you just gathered. And before you touch anything, always review the vital signs. Vitals are high yield. They can give you major clinical clues right away, and skipping over them is a mistake a lot of students make. As you go through the exam, document abnormal findings immediately in your key findings list. Don't wait until the end. Capture both pertinent positives and pertinent negatives. This is what demonstrates real clinical reasoning, and it's exactly what the system is scoring you on. Now let's talk strategy based on case type. For skin rash cases, especially in the early weeks, perform a full skin exam. And don't forget lymph nodes and HEENT if relevant. For abdominal pain cases, you need a complete abdominal exam. Only add GU or rectal exams if they're clinically indicated. For back pain or neurological cases, like the ones you'll see later, focus on the musculoskeletal system and perform a thorough neuro exam, including strength, reflexes, and sensation. And for sore throat cases, concentrate on HEENT, the neck and the lungs. Now here are a few pro tips. Follow the system's guidance, but don't over-examine. Clicking too many systems doesn't help you. It wastes time and can actually lower your score. You also need to get comfortable recognizing normal versus abnormal findings. The faster you can spot what matters, the stronger your performance will be. Here's a documentation hack that a lot of students overlook. Use the patient record or EHR section strategically. Link your physical exam findings directly to your assessment and plan. That connection makes your documentation cleaner, stronger, and more professional. At the end of the day, a focused and well-executed physical exam is what separates students who just pass from those who consistently score high. Master this, and the rest of the case becomes much easier. If this helped you, hit like, subscribe, and stay locked in. And if you're working on a case right now, send an email with the title of the case. I'll help you break it down. I'll see you in the next one.